Good afternoon and welcome. Whether you're joining us in person or via live stream at facebook.com/OR Marketplace, we're glad you're here. It's nearly time to sign up for health insurance at healthcare.gov, and we are working to spread that message on the ground, over the air, and online. My name is Chicky Flowers. I'm the administrator for the Oregon Health Insurance Marketplace. We are the state-level counterpart of healthcare.gov, and we're a division of the Department of Consumer and Business Services. Joining us today are our fellow Oregonians who represent why health coverage matters and how to get enrolled. We're honored to be led in our efforts by our very own Governor Kate Brown. Without further ado, please join me in welcoming Governor Brown.
Good afternoon, everyone. It absolutely warms my heart to be here today with so many people who care so deeply about the health of Oregonians across the state. Your work is more important than ever. There's a lot of divisive rhetoric and distractions on the national stage about health care, but in Oregon, we must keep focused. We actually believe that people ought to have access to health care in this great state of Oregon. Despite all the noise in Washington, D.C., starting November 1st, Oregonians will once again be able to purchase health plans on healthcare.gov. Right now, 95% of adults and 100% of our children have access to health insurance coverage. Most Oregonians have insurance through their job or other programs that are available. But if you don't have insurance through your job or it's unaffordable, come visit our marketplace. You may even qualify for financial assistance. Last year, most Oregonians who used healthcare.gov got help paying for coverage. It brought their premiums down to an average of $147 a month. That's significant. Let's talk about what this program looks like for one person. Kevin Szilagyi is a young man from Gresham and is one of the 155,000 Oregonians who enrolled through healthcare.gov last year. He's a University of Oregon alum and an environmental educator. He told us he got covered because even though he's never had to go to the hospital, but if he did, without health insurance, it would be instant bankruptcy. Health insurance doesn't just protect your health, it protects your finances. These options are available throughout Oregon. Every county in Oregon has at least 3 plans to choose from, and in some, as many as 31. There are people in every county who can answer your health insurance questions for free, which you might need if you're choosing from 31 plans. The Oregon Health Insurance Marketplace is ready for you. We are spreading the word, answering your questions, and supporting a network of local experts who can help you enroll in affordable health insurance. Community groups across the state are also ready to help as well. They provide application assistance for healthcare.gov customers. They are especially well-versed in Oregon health plan eligibility standards and benefits. They can make sure that when a person looking for coverage walks in, they can get the right answers and help through the process. So, if you don't have health insurance through your job, take advantage of our plans. Support and financial assistance are available. Starting November 1st, that's the day after Halloween, with a deadline of December 15th, get your health coverage at OregonHealthcare.gov. Thank you.
Thank you, Governor Brown. Kevin Szilagyi of Gresham, whom the governor mentioned, is here with us today. Kevin?
Good afternoon. My name is Kevin Szilagyi, like Governor Brown mentioned. I am a consumer of healthcare through the Oregon through the healthcare.gov marketplace. Forgive me. Initially, when my income was a little lower a couple of years ago, I got health insurance through the Oregon Health Plan, which was provided to me for a few years. As my income rose over the course of time, I was able to get private health insurance, which I received financial support from, and then was able to pay for on my own throughout the course of my income increasing over time. I grew up in the generation that did everything on computers. We always had access to computers. And using healthcare.gov was relatively simple. Like Governor Brown mentioned, one of the more complicated and difficult parts was trying to pick a plan that was right for me from all those different options. Anytime I had problems or didn't know what to do, I was able to call the healthcare.gov hotline, and kind, knowledgeable people were always there, willing and interested to help answer any questions that I might have. Like Governor Brown said, the last few years having health insurance has given me peace of mind. Being a person with low income, if I had to need to go to the hospital for any emergency without health insurance, it would have meant bankruptcy. Now the last couple of years that I've had health insurance, it's given me that peace of mind. So get out there, go to healthcare.gov, get yourself enrolled, and don't worry about it.
Thank you very much, Kevin. Next is Onkor Dolakea of Portland. Onkor owns Cafe 11 in Northeast Portland. He's one of many self-employed people who find coverage at healthcare.gov. Please put your hands together for Onkor.
Hello, thanks for having me. Thank you, Governor Brown, for having me. Like I was introduced, I'm a coffee shop owner in Northeast Portland, and about 4.5 years ago, I decided to leave my full-time career and venture out into the freelance world, and that time ACA was passing, and so for me that was great because I initially thought healthcare was expensive, but with these tax breaks and with my sporadic income, didn't really know how much I was going to make as a freelancer. These tax breaks really helped. So, that gave me a peace of mind. I didn't have to worry about anything. If I got hurt or injured, I was set because I had health care. And in the last couple of years, the few things I learned is to stay on top of deadlines for income verification and verification of this, verification of that. At times, I got a little sidetracked or got scrambled to figure out what do I need to do. But the folks at healthcare.gov and Oregon Health Plan and other agencies kind of helped me and told me you need to submit this paperwork for this and this. So again, I'm glad this exists here in Oregon, and go enroll. It's pretty easy and simple to do. That's it. Thank you very much. Yep.
Thank you, Onkor. As Onkor told us, a key part of the enrollment process is choosing which plan is the right one for you. Licensed insurance agents assist clients with that, and their help is free of charge. Diane Faligowski is an insurance agent and was selected as a partner agent with the marketplace. Partner agents receive grants to expand their outreach and assistance. Their community roots and professional excellence are some of the criteria for these grant awards. Please join me in welcoming Diane Faligowski.
Thank you, Governor, for the invitation. I appreciate it. My name is Diane Faligowski, and I'm the owner and principal agent of health plans in Oregon. We do have several offices in Portland and Beaverton area, and we do run a lot of enrollment events with Multnomah County. We go to a lot of the community clinics, churches, and community centers. We have over a dozen of highly trained and committed insurance agents that is willing to help all Oregonians. Many Oregonians are not aware of their health insurance options and the financial assistance that could help reduce their cost. And our job is to really help everybody qualify for affordable health insurance and get everybody qualified for tax credits and financial assistance and enroll everybody with a health plan that fits their needs and their budget. Our philosophy is that everyone deserves to have health insurance regardless of age, income, ethnicity, or health or color. We have had the privilege of helping thousands of clients in the last, maybe since 2006 when I was 12 years old. And in many cases, a lot of our clients are able to access much needed surgery, cancer therapy, or dialysis for the case of one of our newer COFA members. Our agency has partnered with the Oregon Health Insurance Marketplace ever since ACA has started back in 2014. Remember those days? But we've come a long ways, and we're still here trying to help everybody have access to affordable health insurance. We're very honored and really thankful for the Oregon Health Insurance Marketplace for their support, and truly with all the community partners, Project Access, CAN, DHS, and OHA, we're very thankful for all of your support, and being able to help everybody have access to affordable health insurance and making a difference on someone's health care is really what keeps us going. And our agency is committed to work every single day, 16 hours a day if needed, up until December 15. Thank you so much.
Thank you very much, Diane. Next is Neshoba Temperley. Neshoba is on staff here at Cascade Aids Project, one of the Marketplace's community partners. Community partners also help people enroll, and their assistance also comes free of charge. Neshoba, welcome, and please put your hands together for Neshoba.
All right, thank you. Hello, my name is Neshoba Temperley, and I'm an insurance navigator here at CAP. Along with all of my staff and support networks, we assist individuals through a no wrong door policy, that can assist individuals to purchase private insurance plans, help them navigate our state's Medicaid program, Oregon Health Plan, regardless of citizenship status, socioeconomic class, creed, race, and all of those different factors. Like I said, I'm part of a larger team here that connects individuals with access to housing, prepares people with competent and free STI and HIV testing, and of course, helping individuals access health care. We also have a fully functioning primary care health facility that has just opened, the first of its kind in the state to focus on LGBTQ populations, Prism Health, and we're very proud of those achievements. You know, I really had the great fortune in my time as a navigator to see a lot of personal transformations because of accessing healthcare. You know, I've seen folks re-enter healthcare world after cancer diagnoses and giving up, and I've witnessed the power of those changes and the personal resiliency that folks can have with access information to be able to make their own choices and to be able to get the financial assistance that they so direly need. So lastly, I would just really like to thank all the support systems and the governor for supporting our assister network, because without all of these different resources, it would for surely have many thousands of Oregonians would have a much greater, higher impact negatively. So thank you.
Thank you, Neshoba. Our final speaker is Multnomah County Commissioner Sharon Myron. In addition to representing District 1 in the county, she is also an emergency room doctor and community health advocate. Please join me in welcoming Commissioner Myron.
Thank you, Chiki. So, as both an ER doctor and a county commissioner, I know firsthand how important it is to have insurance. When the ACA first passed, I still remember it. I saw a significant increase in the number of people I was seeing in the ER, and many of them were very sick. They had breathing problems, cancer, they had heart conditions, and they were all in pretty advanced stages. They came to the ER to see me because finally they had insurance and weren't worried that being sick would bankrupt them or harm their families. I, as a physician, finally had a way to coordinate their care, which was something really exciting to me. And I could send them finally to primary care providers and specialists and the people that could prevent them from getting sicker and needing to come to the ER in the first place. In Oregon, very proud to say that preventable ER visits have dropped by around 50% since someone said wow, since implementation of the Affordable Care Act. And we've also seen a huge difference in Multnomah County as well. The percent of uninsured patients visiting Multnomah County's health centers has dropped by nearly half since implementation of the ACA. This is a dramatic improvement, and it's why it is so incredibly important that we get the word out about this year's open enrollment so we can maintain and build on the accomplishments that we've already been seeing. Multnomah County is helping to make sure people can get insurance through healthcare.gov during open enrollment season this year. We have planned, through the health department, 6 weeks of free enrollment sessions, including enrollment fairs at Central, Midland, Kenton, Belmont, and Holgate libraries, as well as at all county health clinics. For a complete list, you can go to multco, multco.us, and search health insurance. So there is a lot going on, and if you do need health insurance, be sure to attend one of these enrollment sessions as early as possible. The shorter open enrollment time this year makes it even more important that you act quickly, so you get the full information and the help you need from trained staff that can help you identify your options. So go forth and get insurance, and thank you.
Thank you, Commissioner. So thank you all for joining us today. Thank you to Kevin, Unker, Diane, Nishoba, Commissioner Myron, and Governor Brown. Thank you, Cascades Aids Project, for hosting us today. So thank you all for joining us today. As Governor Brown mentioned, open enrollment starts November 1st. It's the day after Halloween. Halloween is tomorrow. So please, please mark your calendars. Healthcare.gov is open for window shopping right now. Open enrollment starts on Wednesday, November 1st. If you have any questions we can help answer, please find the DCBS staff or Governor Brown after this. Thank you very much and have a great evening.